Okay, so today we are going to perform a bedside swallowing evaluation on my client. But before I would actually proceed with the evaluation, I would want to conduct a thorough review of her case history, as well as do a chart review in order to gather as much information as I could about my patient before performing the evaluation. Hi, Mrs. Bachman. My name is Ashley from Speech Therapy. How are you doing today?
I'm good. It's nice to meet you.
It's nice to meet you as well. So, can you tell me your full name?
Renee Ann Bachman,
Okay, and can you tell me your date of birth?
2/1869.
Great. So, I have some questions for you. Can you tell me what year we're in?
2018.
Okay, great. Now, can I ask you to just go ahead and sit up straight for me? Okay. Can you open your mouth? Good. Now, can you close your mouth? Great. Thank you. So this was to test her level of cognitive awareness and to assess her ability to follow directions. So I know if she is alert and coherent enough to proceed with the bedside evaluation. It also allows me to know if she can follow simple directions. So I know if she is able to understand what is being asked of her, and I know that she is able to accurately perform these throughout the evaluation. I would also want to make some basic observations about her level of alertness, her position in bed, whether or not she has a feeding tube or tracheostomy tube present, and I would want to observe her respiratory rate to make sure that it is in a coordinated rhythmical movement, which is important. All right, Mrs. Bachman, we are going to go ahead and proceed with the bedside swallowing evaluation.
Okay.
What this is going to consist of is I'm going to ask you to open up your mouth. I'm going to take a look in there, make some observations, make sure everything looks adequate in there. And then I'm going to ask you to just perform some simple tasks for me.
Okay.
And later on, I have some thin liquids. It's just water and some foods of a little bit thicker and thicker consistencies and more volumes. And I'm going to have you just eat them and take a drink of them, and I will see how your swallow is functioning.
Okay.
Great. Do you have any questions for me before we get
No,
started?
I do not.
Okay, great. Can you open up your mouth for me?
Mm-hmm.
Great. Can you close it? I'm going to have you to go ahead and open up again. I'm going to go ahead and take a look inside. Looks like you have a nice pink color. Looks like you have all of your teeth. That's good. No signs of dentures. Some lesions on your tongue. Great. Thank you. So that task, I was looking inside of her oral cavity to make sure that I did not see any lesions, and there were no lesions present. I also wanted to inspect the color of her oral cavity. It was a nice pink color. There was no redness, and there was no white color, which could indicate dehydration or thrush. I also wanted to check to see if any teeth were missing, because that could make chewing difficult. There were no missing teeth, and she did not have any dentures, so I did not have to worry about that. And patients who do present with dentures, you do want to make sure that their dentures fit. And you also you want to make sure that they fit, as well as being aware that dentures could reduce sensation in a person's mouth, making it difficult for them to sense that food is in their mouth and sense when it is time to initiate the swallow. I was also inspecting her tongue to make sure that no lesions were on there. There was no scarring, no signs of thrush. Everything looked fine on her tongue. I was also checking the lateral borders of her tongue to check for any fasciculations or atrophy. There was none, but in patients who do present with that, it could give them some type of difficulty in the oral phase whenever they are elevating that tongue tip and the lateral borders are coming up to propel that bolus, or that's the beginning of that phase. So that could present some difficulty in clients who have fasciculations, but we did not have any trouble with this patient, so there was nothing to note of that. I was also examining her face at rest to make sure that everything was symmetrical, and it was. I also would want to make any note of drooling She was able to manage her secretions well because I did not see any drooling or any droopiness of either side of her face. So everything looked fine there. I'm going to go ahead and proceed with the evaluation, doing a cranial nerve assessment as well as an oral mechanism exam. And I'm going to be using the oropharyngeal examination for the clinical swallow examination from our book, and I'm just going to be modifying some tasks from that when I go through with the evaluation. Okay, Mrs. Bachman, are you ready to get started?
I am.
Okay, can you open and close your jaw for me? Can you move your jaw from side to side for me? Good. Now for this next task, I'm going to probably have to put my hands on your mouth or on your face. Is that going to be an issue?
That's fine.
Okay, can you go ahead and bite down for me?
Mm-hmm.
Thank you. So this was assessing cranial nerve 5. I was looking for symmetry of these movements, but I also would want to make note if the patient was having any difficulty with these tasks, especially if the patient was having difficulty opening and closing their mouth, as that could be a sign of trismus. I would also want to consider when reporting that I could not tell if there was any weakness when she was biting down. I could only feel that there was tension and that she was able to bite down and clench because her jaw clenched. Okay, Mrs. Bachman, can you pucker your lips for me? Great. Can you smile for me? Can you pucker and then smile? Raise your eyebrows for me. Good. This next task, I'm going to put my tongue depressor between your lips, and I want you to close your lips around them, and I'm going to try to pull away, and I just want you to hold your lips down around the tongue depressor, okay? Do you understand?
Yeah, I think so.
Okay. Okay. Now, keep your lips closed, and I'm going to try to come into your mouth. So these tasks were assessing cranial nerve 7. The last 2 tasks that I performed were assessing her ability to maintain a labial seal, which she did not have any trouble with, so that is a good indicator. So while some people may say that we're only assessing a patient's ability to perform these certain tasks, such as we're only assessing her ability to pucker or ability to smile, these tasks are important to note. They are important to consider when assessing because it allows us to know, it allows us to assess the upper and lower facial muscles to differentiate between upper and lower motor neuron damage, as well as assessing the symmetry. So everything was fine with her. I did not have any concerns. Okay, Mrs. Bachman, this next task is going to be a little bit uncomfortable, so I apologize in advance. But I'm just going to have you open up your mouth, and I'm going to test your gag reflex. So I am going to have to touch the back of your throat to see your gag reflex. Go ahead and open up for me. Can you hold your head straight, keep that tongue down? Thank you. I'm sorry, I know that is a little bit uncomfortable, but I appreciate you being such a good sport and cooperating. Okay, so now can you say ah for me? Ah. Do that again. Ah. Can you say ah, 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 ah? All right, Mrs. Bachman, can you go ahead and give me a really good, strong cough? Okay. Now, I'm going to have to go ahead and touch you again if you don't mind. This next task that I ask you to do is I'm just going to have you go ahead and dry swallow. And I'm going to put my fingers on your throat, and I'm just going to feel you swallow, okay?
Okay.
Okay, go ahead and say ah for me.
Ah.
Great, thank you so much. So these tasks were assessing cranial nerves 9 and 10. I was checking for symmetry of her velum while she was sustaining and repeating the ah, and everything was symmetrical there. There was no problems. I was also assessing her quality, voice, and pitch. I would want to know any hypo or hypernasality that was observed. She did not have any of that, but if the patient did have that, it could indicate that there may be some type of occlusion, but I would want to be very careful when reporting that because I do not have any way to see if there's any occlusion. I am only making an assumption that there might be based on the hyper or hyponasality. Assessing her gag reflex really did not provide me with a lot of information because there were not any signs of trouble before this. there were no other signs that would really make me concerned. But if the patient did show signs that might give me some type of concern, testing the gag reflex might tell us if there is too much, if it is too active or not active enough, if the sensation, is too active or not active enough. I also wanted to make sure that she could provide a voluntary cough. That might be an important strategy that we would maybe have to use. With her, we probably wouldn't have to because, again, everything has seemed pretty normal, but assessing that voluntary cough just ensures that she can perform that task if she would have to dispel anything from her airway if a foreign material would get into the airway. I also assessed her voice quality after the swallow to see if any change had occurred. No change had occurred, but if there was change, I might have seen a gurgly or wet quality to the patient's voice, and I would want to consider that to be a sign of a possible aspiration, but again, I would not want to note that she was aspirating because I do not have any way to objectively measure that or to see that. And finally, whenever I asked her to swallow and I palpated it, it allowed me to feel the movement whenever she did swallow. So I would only want to note whether or not movement was present. All right, Mrs. Bachman, can you stick out your tongue for me? Great. Can you move your tongue from side to side? Now can you touch your tongue up to that bumpy part, the rigid part behind your teeth? Okay. Now I just want you to say ta 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 ta.
Ta 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 ta.
Great. Now can you say padaka padaka padaka?
Padaka padaka padaka.
Okay, so now I want you to bring your tongue up to that little bumpy part behind your teeth, and I want you to move it to the back, kind of like you're clearing peanut butter from the roof of your mouth. Good. So those tasks were assessing cranial nerve 12. I was noting the patient's tongue range of movement. Everything seemed normal there, which is important for manipulating and lateralizing the bolus as well as clearing any residue. When commenting on tongue strength, I would want to be very careful because I do not have anything to accurately measure how strong her tongue was. So I would want to just be very careful about commenting on that. I was also assessing her ability to produce rapid tongue repetition and alternation movements when having her produce ta and padaka repeatedly, and she was able to perform those tasks with no trouble at all. So I would not be able to truly observe the physical functions of the swallow for the pharyngeal and the laryngeal phases from a bedside swallowing evaluation because I'm not able to see those or observe those in my patient without some type of an instrumental assessment. So an instrumental assessment would be needed to get a better idea of what is happening during those phases of the swallow. Because there weren't any facial, tongue, or palatal weakness, I am going to go ahead and proceed with trial swallows to get more of an idea of what is happening for this patient during swallowing. And it's important to just remember that this still is not going to give us an accurate measurement because we still cannot really see what's going on in the oral cavity and really even during the oral preparatory phase, and definitely not during the pharyngeal and laryngeal phases of the swallow. So, bless you.
Excuse me, I'm sorry.
It's okay. So we just want to be very careful when reporting this and note that an instrumental assessment would really give us a better idea of what is going on. Okay, Mrs. Bachman, so for the very last part of this evaluation, I'm going to present you with some thin liquids, which is just water, and then some food that have different consistencies to them. And I'm just going to have you perform some certain tasks for me, and this is just going to help me get a better understanding of the functioning that you're swallowing, okay?
Okay.
Do you have any questions before we get started?
No, I do not.
Okay. So the first thing we're going to go ahead and get started with is water. So I'm just going to give you a really small amount just to see how you do with them. And if you do well with that, we're going to go ahead and increase that and I'll give you some more. So what is going to happen is I'm going to present you with just a little bit of water. I am going to feel your throat so I can feel the swallow. And then once I've sat back down, I just want you to go ahead and say ah for me. I'm going to look into your mouth to make sure that there's no residue. Do you have any questions before we get started?
I think so.
Okay. go ahead and say ah for me.
Ah.
Can you lift up your tongue for me? Great, I don't see any residue. Wonderful. So we're going to go ahead and I'm going to give you a little bit more.
Okay.
Go ahead and say ah for me.
Ah. Ah.
Can you lift up that tongue? Wonderful. I don't see any residue. That's great. Okay, so now I'm just going to go ahead and have you present the water to yourself.
Okay.
And we're just going to do the exact same thing that we just did.
Okay. Ah.
Great. Thank you so much, Mrs. Bachman.
Oh,
We're finished with that test. Yep, that's all right. So now we're going to go ahead and move on. We're going to keep this, but we're going to get rid of the spoon. So I'm going to present this to you, and I just want you to take a drink of it. Same thing's going to happen. I'm going to feel your throat, then I'll have you say ah, and I'll check into your mouth, okay?
Okay.
All right.
Ah.
Great. No residue. So I'll go ahead and have you present this to yourself.
Ah.
Great. All right, Mrs. Bachman. So now we're going to just keep the liquids, but we're going to move on to a straw. So I'm just going to have you present this to yourself this time. I just want you to take a drink of the straw. We're just going to continue doing the same thing that we did.
Okay. Ah.
Great. No residue. So now for this next task, I'm going to have you take some sequential sips. So what that means is I just want you to take 3 sips using the straw, and we'll just continue where I'll feel your throat and I'll check in your mouth. Do you have any questions?
Okay. I don't think so.
Okay, go ahead. Great. Not seeing any residue there. Great, thank you so much for that, Mrs. Bachman. So during that task, I was looking for residue in the lateral and anterior sulci. There was none noted, but I would want to know that I could not see if any pooling was occurring and any residue was stuck in the valleculae. Sometimes that could happen. That would be troublesome because that could allow the patient to potentially aspirate. So we would want to just be very careful with that, and I would only want to report that I can see that there were no residue left over in the lateral and anterior sulci. I was also feeling for some type of movement during the swallows. Again, I cannot really say that the hyolaryngeal excursion was happening because I can't really see it, but I would be able to note that I was feeling movement when the swallow was occurring. There did not really appear to be any delay in her swallow either, as she was able to swallow with no problem. Having her say ah allowed for me to assess her voice and pitch quality to make sure that there was not any wet or gurgliness to her voice, which again could be potential signs of aspiration, but I would want to make sure that I would not note that aspiration was occurring simply because she had a wet gurgly voice, because again, I'm not able to see that. All right, Mrs. Bachman, so now we're going to go ahead and move on to the applesauce. I'm going to present you with just a small amount, see how you do with that. If you do all right with that, I'll move on to a bigger amount, and then I'll have you go ahead and present it to yourself.
Okay.
So we'll just continue with this. I will have you say ah, and then I'll check your mouth for any residue. Do you have any questions?
No.
Okay.
Ah.
I'm not seeing any residue. Can you say ah for me again?
Ah.
Great. Thank you. I'm going to give you a little bit more. Good, I'm not seeing any residue left over. That's great. So now I just want you to go ahead and present this to yourself. Put as much on there that you would normally take a bite of. Good. So again, I was looking for residue and change to vocal quality during that task. Residue left over could indicate weak tongue movement used for clearing or difficulty propelling the bolus back. But again, I'm not able to actually see those things as her mouth was closed during that entire phase. So I would want to be very careful in how I would report that. Obviously, an instrumental assessment would really give me a better idea, but I am able to note any residue left over, so I would be looking for that. Again, I was looking for any change in voice quality to be a potential sign of aspiration, but I would again want to watch how I would report that. All right. Now we're on our last task for this, Mrs. Bachman. I'm going to present you with a cracker, and I just want you to take a bite of that like you normally would, but I'm going to ask you to do something a little different this time. I want you to open up your mouth before you swallow, so I can take a look at that food, and I know it might seem a little uncomfortable and a little gross, but it's okay. So go ahead and open your mouth to show me the cracker before you get ready to swallow.
Okay.
Okay? Okay, go ahead and say ah for me. Okay. Not so much residue left over, that's great. Thank you for that. So, can you feel anything back there? Do you feel anything, any fullness? No? No? Okay. Do you have any difficulty swallowing certain foods, or is it painful for you?
No, it's not.
No? Okay, great. So I'm going to go ahead and have you just fill out this questionnaire, and this just provides me with more information about trouble that you have with swallowing, if there is any, or if there's not any. So you can go ahead and fill this out for me.
Okay.
So the very last task with the cracker, I was looking for a cohesive bolus to form before the swallow was initiated. There was some residue in her back molars, but that's pretty normal, very typical. So that would not really be any cause of concern for me. Again, as I wasn't really able to see how she was forming the cohesive bolus, so I wouldn't want to note if she had trouble forming the bolus, because I can't really see that. I can only see if the bolus was formed and if it was in the medial part of her tongue before the swallow, which it was. So based on all the factors, I really did not have many problems with her. I really would not recommend her for further assessment or an instrumental assessment due to everything's being fairly typical. Another thing that might be of concern, or one thing that I might want to watch, is when I asked her to perform the task beforehand, she might have been a little nervous about it, or she might have been more aware about it, so she might have unknowingly formed more of the bolus. So because I kind of gave her a heads up before doing that, it might have not been as indicative of typical results. So if there were any abnormalities that were noted, I would want to go ahead and follow up with an instrumental assessment, and also potentially do a mealtime observation if I was able to, because that would give me a better idea of the type of difficulty she has whenever she's not being given smaller amounts of food and whenever she's not being watched, because sometimes that can make people feel very uncomfortable. So are you finished with this, Mrs. Bachman?
I am.
Okay, great. Thank you so much. I just want to thank you again for your cooperation and your participation during this evaluation. I know it's a little bit uncomfortable, and this is not typically the way that you would probably eat your foods, but I just want to thank you for being so cooperative, and we will hopefully get these results back to you in a short amount of time so you can
Okay,
get
great.
the results.
Thank
Thank
you.
you.